Physical activity is defined as body movement produced by skeletal muscles that requires energy expenditure. Appropriate practice of physical activity can assist in developing musculoskeletal tissues, cardiovascular system, and it helps to maintain a healthy body weight. According to World Health Organization, physical inactivity is the fourth leading risk factor for global mortality. Childhood obesity is one of the most important public health issues of the 21st century. Globally, in 2013, the number of overweight children under the age of 5 is estimated to be over 42 million. Close to 31 million of these children are living in developing countries. Overweight and obese children are more likely to stay obese into adulthood and more likely to develop chronic diseases, including but not limited to cardiovascular diseases, diabetes at a younger age. Only about 42% of American children are completing the recommended amount of physical exercise at ages 6 to 11. For youth, ages 12 to 15, this number further drops to as low as 8%. African American and Hispanic children are especially prone to the problem of the lack of exercise. In our study, we used trans-theoretical model and self-efficacy theory to evaluate the problem of the lack of physical activity. According to trans-theoretical model, individual is in one of the 5 stages of change to adopting physical activity behavior. The goal is to ultimately reach the maintenance stage of regular physical activity. Self-efficacy theory states that competence will affect behavior. In our study, over the 12-week period of intervention, African American children and youth completed the cardiovascular activities, strength training exercise, and they attended health and nutrition information sessions. They also completed self-report measures of state of change and self-efficacy. It was found the more advanced stage of the trans-theoretical model is associated with greater self-efficacy. In other words, participants in the stages of non-action were less confident to overcome barriers to physical activity than participants in the stages of action. Therefore, self-efficacy is very important for children and youth to maintain physical activity. Childhood obesity is preventable. It is up to us to make it possible.